with Regina introduce herself first, and then I'll get on the mic. But she's the reason that this got put together. She put a lot of work into this. So I want to give her a few minutes to be able to introduce herself and introduce what we'll be discussing today on the first day of open enrollment period, and then we'll get started.
Hello, everyone. Okay, of course, I'm Regina Owens. I'm the 50 Plus Ministry Leader. Also, I'm a Medicare agent broker. And I'm here because there's so many changes going on now. Too many, and people are satisfied with what they have, but they don't know what they have because it's not the same anymore. So we're here to discuss, not the changes, we're here to educate you on Medicare. Because so many people are not educated. And so that's my main reason here.
Okay, we have a slide here. I'm not gonna go through everything on the slide, but I will go over some of the content. But this is a sizable enough group where we can keep this as an open dialogue for anyone that has questions, anyone that's been seeing anything that's concerning, and make sure that all of your concerns are answered. This year is the first year that a few changes have been implemented based off of the new administration. Remember, Medicare is a federal program. So when the administration changes, I've been in this industry now for 8 years. So I've seen 3 different administrations. This one, you know, is a double back, but I've seen 3 different administrations, so the regulations tend to change based off of who's in office. And so some of those regulations you see as the Medicare beneficiary, some of them you don't. This year, you're seeing it. There's definitely changes in terms of the prescriptions cost, in terms of how much the insurance companies are being reimbursed. And so things are tightening for them, and they're not going to take the hit. So it ends up tightening for the beneficiaries. So you might be getting, everyone here that is on Medicare Advantage should have been getting an annual notice of change. That's called an ANOC. And that's what's going to explain to you what's the difference on the plan that you have now between 2025 and 2026. And is anybody here not on Medicare Advantage? Anybody here getting insurance through their retiree coverage or anything like that? So someone such as yourself, and Regina, I think you're the same, the post office. I just had an agent call me, and she asked me about someone that asked her about a give back program, and that's when they put money back into your Social Security for a federal retiree. And I had to say to her, you don't touch those, because when you're in a federal retiree program, if you leave it, you could possibly never get back on. So for those that are on federal retiree programs, I always encourage my agents to leave those individuals be. However, most people are not afforded that kind of coverage, so they have to go on what's called Medicare Advantage programs. So everyone here should have learned about the basics of like Part A, Part B, Part C, Part D. And so this is a basic, what is Medicare? Medicare is a federally funded health insurance program for anyone that's either 65 and older and received their 40 quarters, or considered disabled and received their 40 quarters. So you can't just be 65 and say, oh, I'm getting Medicare. No, you have to be 65, you had to have worked at least 10 years full-time in this country on the books, and be able to get your 40 quarters in order to qualify for Medicare Part A and Part B. People keep on switching the word Medicare and Medicaid, and how you always remember what you're referring to is Medicare. The word care stands for health care. Medicaid, when you hear the word aid, it stands for financial aid. So in order for you to get on Medicare, we just went over those qualifications about age and disability and Social Security. You get on Medicaid if your income is considered low by the state. Medicare is federal. Medicaid is state to state. So somebody in Virginia could get Medicaid making, in Virginia right now, in order for you to get on Medicaid, you can't be making more than $1,200 a month. It's about that ballpark. Whereas you go to Mississippi or you go to Florida, it's as low as like in the $400 or $500 a month. So Medicaid is run by the states, and the states determine what somebody has to make in order to get on Medicaid. I'm originally from New York, and because the cost of living is so high in New York, Medicaid in New York, you can get on Medicaid and make up to $1,650 a month. So they base it based off of the cost of living of the area and so forth. So that's always a way to remember, are they talking about Medicaid or Medicare? You hear that ending of it. So we went over who can get Medicare, We went over the age and the disability qualifications. Some people get on both, and that's where you see the dual special needs plans. So sometimes somebody gets on Medicare and Medicaid if they qualify based off of their age, and they make the financial qualifications. So in order to get on both, you have to meet both the age disability requirement, and you have to meet the financial qualifications. It says, can you work past the age of 65? So not only can you work past the age of 65, now more than ever they're seeing people working past the age of 65 because the Social Security income is not enough for a lot of people. So both of my parents are over the age of 65, and they're both still working. My mother says she's never going to stop working. So what happens with someone like that? When you get Medicare Part A, that's free for everybody that reach their 40 quarters. Part B is the one that you're seeing coming out of your Social Security check that keeps creeping up higher and higher and higher. I think this year it's $185 and some change. You do not have to get Part B if you are getting medical coverage from either your employer or your retiree program that gives you medical coverage. So my father, because he's still working, I made him return his Part B because he's still working and he's getting coverage from his union, and he's getting spousal coverage from my mother as her insurance is paying for her. So somebody like him, he doesn't need Part B. However, if you're not receiving those benefits through a job, a spouse, or something of that nature, not only do you need to get Part B so that you can have some medical coverage, Medicare and Social Security will penalize you if you do not get it. So people that go without Part B and cannot prove to them that they had medical coverage through another means, they will have a penalty, and it's actually pretty hefty. And once they calculate the penalty, they attach it and take it away from your Social Security every single month for the rest of your life. That's both for Part B penalty and Part D penalty. Part D as in David stands for pharmaceutical coverage. You have to also have prescription coverage. So A is hospital, so that you have coverage for the hospital. Part B as in boy is medical, so you can go to the doctor, you can go to the ER, you can get durable medical equipment like a cane or a walker. Part D as in David is going to the pharmacy and getting your medication. If you're getting an injection at the doctor's office, that's not Part D as in David because you didn't have to go through the pharmacy. Part D as in David is coverage so you can go to a CVS, so you can go to a Walgreens and pick up your prescription. It's coverage for you to get mail order. Part C as in cat is when you take all of those pieces and put it together and have comprehensive coverage so that you can get both your medical, your hospital, and your prescription in one. Anybody have any questions about that before I move forward? Yes. Yes, that's the Part D as in David. So if you are just going about and you've had your red, white, and blue card and you said, that's all I need, I'm not going to get any prescription drug coverage. My medications are cheap. I'll just pay for it cash at the pharmacy. Um, if you ever join a prescription drug plan or a Part C plan that has prescription drug coverage in it, Medicare is going to say, this person hasn't been on prescription drug coverage since the beginning of their Medicare. It looks like it's been 15 months that they have been without prescription drug coverage. They're going to send you a letter, and they're going to say, you have not had prescription drug coverage for 15 months. Show us some proof that you've had it with somebody else. And if you're able to say, listen, I had union coverage, I had spousal coverage through prescription coverage or something like that, then they'll say, fine, boom. If they find that you did not have it or you're unable to furnish record of having prescription drug coverage, that's when they'll calculate the penalty per month and then attach it to take away from your Social Security. The only population that they allow to not do that is veterans that get their medication from the VA. So if someone's a veteran and they're getting their medications from the VA, the government will say that that's enough coverage to not have to get a prescription drug plan through somewhere else. Okay? Anybody else with any other questions? Okay. So that's why it says, what if that last question there was, sorry, clicking too fast for my own good. Oh, sorry. That last question was, what if I'm covered by my spouse's employer? And that's an example that I just gave from my father, right? So if you're covered by your spouse's employer, that is deemed credible coverage. And getting Medicare while still working, Medicare and your employer insurance can work together. So if someone's working and you get Medicare, your employer's insurance coverage is notified about that. And then they work together, because the goal is that Medicare is always your primary insurance. It's always the backbone of your insurance working in the background, and then everything else is supplementary. It doesn't matter if you have 15 insurances. The first one that pays out is going to always be Medicare, because that's the pool, that's the pot. That's why they've been taking money out of your check every month for all your life. That is the main source of insurance for anybody that is on it. Everything there falls after. And Medicare for Part B pays 80%. 20% is your responsibility, so you can either have insurance that picks it up. If you have two different insurances, maybe some pick up this and some pick up that. That's how it works. But the first one ever is going to be Medicare, okay? So we went over A being hospital. We went over B being medical. We went over those parts. We went over D being prescription drug coverage. We also, what we didn't go over is, has anyone here ever heard of Medicare supplement or Medigap? No? Yeah? Okay. So Medicare supplement is a program that is run by the insurance companies and the states. So it varies from state to state. And it is a form of helping you pay for that 20% that Medicare doesn't cover. The beauty of Medicare supplement is that it operates like the Medicare card, where you can go anywhere in the country and see any doctor. Everybody accepts it, right? Whereas if you're joining Aetna, or if you're joining United, or if you're joining Humana Medicare Advantage, you have to stay within the network. That's not the case when you deal with Medicare supplement. The difference, though, with Medicare supplement and the other Medicare Advantage plans is that Medicare supplement, you have to pay a premium for that. So usually Medicare supplement, depending on the plan you choose, and it can go anywhere from A to N, you can be paying anywhere between $90-something a month to like up to $500 a month. And that's on top of the Part B premium. And that does not include dental, vision, hearing, or prescription. So you have to buy those separately. So those are for people that either just have a lot of money to blow, or they really medically need it. I have some clients that are on it, and like I have a client that's on it now. She's based out of New York, but she has a very rare immune disorder where she has to fly out to Ohio to see her specialist. She can't be bothered with the network. So she can afford to, and she pays the premium out of need for a Medicare supplement. And then I have some wealthy clients who just, they can afford it and they want that option, so they have it. So it's an option that's there. It can be costly, but it's available for anyone that does need it. Now the Part C plans, we went over Part C and we said that the A as in hospital, the B as in medical, and the D as in prescription, all together, that's what's giving you Part C. These are the commercials that you're seeing every time you turn on the television. You keep seeing Part C, Part C, Part C. Part C is the Medicare Advantage plans that you see. They're sponsored by Anthem Blue Cross Blue Shield. They're sponsored by Aetna, Humana, United Healthcare, Centara. All of those companies that you're seeing, they're offering Part C plans for people that have the red, white, and blue card to help pick up the cost. You're seeing that the co-pays can differ from plan to plan, and not just from plan to plan between an Aetna and a Humana. You have to look and see some of the plans, and Humana has about, in the Richmond area for 2026, Humana has about 18 plans. Aetna has about 6. United Healthcare has another 9. You know what I mean? So you have to, it's a lot of plans that are out there to choose from. You really have to identify what your needs are first, and then you find out, and then you work from there. And the way that you identify your needs is saying, what doctors are important to me that I do not want to change, and then what medications are crucial in my day-to-day. So if your medications are an antibiotic that you're taking because you just had surgery, that's not going to be as crucial as a blood pressure medication that you've been on for 5 years that helps maintain your blood pressure. So you have to identify who those doctors are. I remember I had one client. He found a plan that was very affordable for him because he was on a budget, and he had a lot of doctors. He had about 7 or 8 doctors, and I was able to find a really good plan for him, but the 8th doctor was not in, and he was really torn up about it, and it was his podiatrist, and I had to tell him, you can get your toes clipped at many places. If your eye doctor and your heart doctor that you said saved your life, and your primary care physician that you've been with for 20 years has been in this plan, then you want to go based off of the priority of the physician that's really navigating your health care. And that's the doctor that you want. If you have that, everybody doesn't have that relationship with their doctor, but if you do have that relationship with your doctor, it's important that you maintain it, and then that becomes a priority in choosing your health insurance plan. Before I move forward, any other questions that are coming up to anybody? Yes. Mm-hmm. The give back. Mm. That's right. Mm-hmm. So different plans have different give back policies that put back money into your Part B premium. That's the basis of how those give back plans work. The thing about the give back plans is because they're giving you that money back, they tend to be a little bit scarce on the benefits. So usually the give back plan will give you money back into your Social Security, but maybe the co-pays are a lot higher than what another plan would have been. So really it depends on your utilization. I don't like to advise give back plans to clients unless they are just doing regular checkups. That's it. They don't have any surgeries coming up. They don't have any big ticket items like MRIs and CAT scans. they haven't been going to the doctor more than their regular checkups. If you're that kind of client, then I don't mind suggesting the give back to you. But if you're a client that tells me that you were hospitalized last year, or that you have some surgeries coming up, you have some big items coming up that you're thinking of doing with your doctor, you've recently been diagnosed with something serious, then I tend to shy away from the give back plan, because even though it's great that you get the money back in your Part B premium, there's a likelihood that you're going to get billed for something, and you're going to have a high medical deductible, and it's going to cost you more on the back end. So that's how I like to identify for give back plan. But for the plan that you're talking about now that's giving you money back, you want to just check that annual notice of change to make sure it's the same amount that you're getting for 2026. Because it could be more, it could be less. So that's important to check. But it's not that you can just bring that everywhere. You have to get on a plan that specifically has that benefit. Okay? Any other questions? Okay. So we've done a lot about Part C. I think a big question that I tend to get is when people say, what's the difference between HMO? What's the difference between PPO? What's the difference between this special needs plan, that special needs plan? The most popular acronyms you're seeing are HMO and PPO. HMO stands for a health maintenance organization, and a PPO stands for a preferred provider organization. So someone on a PPO has the ability to go in and out of network with their doctors, whereas someone on an HMO has to go to a specific area of doctors within the area. The PPO, I tend to lean towards a PPO for someone who is looking to move around a lot. You travel a lot, you might have family in Florida, your children might be in Arizona, that kind of thing. You spend a couple months here, you spend a couple months there, you're up and down, you're up and down. If you're that kind of client, then yes, I do tend to lean towards a PPO. However, if your travel is just simple vacations, and your primary medical utilization happens within the area under which you live, then I tend to lean towards an HMO, because you'll always have your travel benefits in case of an emergency, and the HMOs tend to be more valuable in terms of cost. So the copays tend to be lower, the benefits like over-the-counter and so forth tend to be higher. But I think anybody here that's had over-the-counter can see, unless you have Medicaid, they've been shaving the over-the-counter benefits more and more and more every year, to the point where for some plans it's just not going to be on there next year. And that also includes transportation. There's some carriers that are removing the transportation in total. And so you really have to identify which benefits you've been using to see what plan is going to give you the benefits that you need and you've been relying on so far. But PPOs tend to not have those little extra benefits like over-the-counter and transportation. Those tend to be more of an HMO thing. And then we went over prescription drug plans. Again, that's Part D as in David. And so prescription drug plans can be purchased by themselves, or they can be included in the Medicare Advantage Part C plan. So it just depends on what situation you're in and what works best for you. But that's for the prescription drug plan. Now, it's important that everybody here that's on any kind of Medicare Advantage plan understands that, especially if you've been taking, brand name medications in the last 2 years, you've been noticing that those have been going up in terms of your out-of-pocket expense, and that's because there was a new regulation that was processed last year where there was a maximum that could be charged for medications across the board for prescriptions. And that maximum last year for 2025 was $2,000. For 2026, it's $2,100. So that means no matter what medication you're taking, if it, in a year, it comes up to more than $2,100, then the insurance companies have to eat it. So how the insurance companies responded to that very non-profitable regulation for them is that they increased the deductible on brand name medications at the top of the year. So next year, the brand name medication deductible is going up to $615 that has to be met in order for you to get your brand name prescriptions. Yes, it is. So brands like Eliquis, another big one is like, I think Jardiance is a big one, Ozempic, those kind of brand name medications, you're gonna have to pay that up front. The caveat to that, the loophole around that is that there is a regulation called the Medicare Prescription Payment Plan that every single insurance company has to participate in. A lot of you might not know about it, but this is how it works. If you have expensive medications like Eliquis and you feel like in January paying that amount in January is just too heavy for you, you can call the customer service department of your insurance plan, it doesn't matter which insurance plan it is, and tell them you want to enroll in the Medicare Prescription Payment Plan. And they have to take the cost of your medication and split it up across 12 months so that you don't have to pay so much up front. So that's important for you to realize if you're taking any medication that's not considered a generic. So how they usually, all the insurance companies break it down is into tiers, which is another word of levels. So tier 1 and tier 2 are gonna be the least expensive, and those are gonna be your generics, whether it be preferred or non-preferred. And those you'll usually be able to get at the pharmacy, mail order, 30, 90 days, $0, no problem. But it's once you get to that tier 3 that $615 deductible is gonna hit. And so you need to be prepared for that mentally, financially, and if it is too much for you and your doctor is really loving the lab results that they're getting with that medication and they really think it's the best medication for you, then you want to consider getting a Medicare prescription payment plan through the insurance company. So you just call up to the customer service and say, I want to be enrolled into the Medicare prescription payment plan. There's nothing else you need to do. You don't need to fill out any extra paperwork. You're entitled to it. It's just that a lot of people are not educated that that is there for them. Yes? Extra help is something that helps with the prescription drug coverage, but there is an income limit to it. So if you are a couple, I believe the income limit is $26,000, and if you are single, it's about $23,000 or $24,000 a year. So anybody that is not in that consideration is not federally considered to be low income, and so then you're not able to get on extra help. Any questions before I move forward? Okay. So we went over the deductible. I told you that the deductible specifically for brand name medications is going up to $615. After your deductible is met, that's when you pay the regular co-payment, and you've noticed that that's not even flat anymore. They're doing it at 25% and so forth for brand name medication. This is last year, so it says 2,000 again. For 2026, it's going up to 2,100. And then once they see you've paid out of pocket for your medication in a year, 2,100, that's when you don't pay for your medication anymore and you enter the catastrophic phase. So that's how those phases work. We went over med subs, we went over prescription drug plans. This is an example of when I said that you can get different kind of Medicare supplement plans. Each plan divides up how they allow you to pay and what they'll pay for. That's how that works. Let me see. These are basic words that you should know, and quite frankly, some of this is even things that you deal with your auto insurance, right? Everybody has a premium. A lot of people have a deductible. Copay is how much you pay at a flat rate. Co-insurance is when it's a percentage. We went over these. How do I choose? So it's a lot of options to choose from. Nobody here, to my knowledge, I don't think anybody here said they're new to Medicare. So everybody here is in a position where you've been on Medicare for a while. You see the changes, you just kind of roll with it as you see fit, right? How you choose is based off of really identifying what's been going on with you. Have you been going to the doctor a lot? Have you been getting any resistance from your doctors for any carrier particularly? Have you been getting a lot of letters in the mail saying that this is not covered or that's not covered? You just want to I know it might not feel like it's something that's doable, but you want to find an ease in your insurance. You want to just go where your doctors are going to accept it. They have a good relationship with the insurance company. You're not getting a lot of pushback, and you're not getting bills that you didn't expect. You know what I mean? Since you've already been on Medicare this long, that's how you want to kind of get a feeling of what's been working for you. And you really, really, I encourage everybody here, if you have not gone over your annual notice of change for 2026, please have a conversation with Regina. She can show you the difference between this year and next year so you can make an informed decision if you should stay put or if you need to make a change, because there's a lot of changes that the insurance companies are making so that they do not feel the brunt of the changes that they're feeling from up top. So it's very important that you're aware of those changes for 2026 so that you can make an informed decision. But other than that, that's the basis of the information you need to be able to move forward this year with this open enrollment period. And I'll close it out with questions. Yes? Not yet. It hasn't. But you won't know until December. I don't think you're going to really know until December. It might happen earlier, but I don't know. Because the fact of the matter is, Bon Secours has been through this with other companies as well. Last year, I think it was Anthem. So what your experience, I know you don't feel like dealing with it because it's bringing you angst, but what you're experiencing on a higher level are companies that are in negotiation and hardballing one another. So then you're feeling the benefit of it because you're getting the letters and so forth. But in reality, one is trying to see who's going to take the bigger hit. Because if Bon Secours sees that all of their members are starting to flood out and just find other doctors, then they're going to step up with whatever negotiations. If Humana is seeing that their members are just leaving Humana more and staying with Bon Secours, then they're going to negotiate differently. And so that's on a higher level, but those are two rich people working it out. But we don't know, because last year they did this with Anthem, and then before December hit, they came up with a deal. And in the meantime, people made a lot of adjustments that they didn't even necessarily have to make. So the reality of the situation is, I would take a look and see other options available and be ready by Thanksgiving on your decision. I wouldn't wait any later than Thanksgiving to make a decision. If you're seeing that you haven't gotten news otherwise by Thanksgiving that something is changing, then I would make an adjustment if you feel that the other insurance companies are just not working out for you. Yes? You can cancel your application. Yes. That's something very important for everybody to know. Before December 7th, everybody has a right to cancel an application that they've submitted. You can call the insurance company that you submitted the application to, and you can say, I want to cancel the application. And you get a confirmation number, and the application will not go through. You'll stay on what you are on. Mm-hmm. Mhm. 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 What you're referring to is open enrollment period. So open enrollment period is different from annual election period. Annual election period is the period we're in right now, October 15th today until December 7th. Open enrollment period is January 1st to March 31st of next year. And what open enrollment period is it's the 3 months that allow you to try out the plan that you got put on. If you like it, you stay on it. If you don't like it, you go back to where you were, or you can go to something different. You get one change in open enrollment period, whereas in annual election period, you can change 100 times. The last application is the one that they'll put you on. Yes. So what is affected by procedures is based on the date that the procedure was done. So the date that the procedure is done is gonna go to the insurance that you had on that date. So if some of people are, I don't know if anybody here is on Centara. Anybody here on Centara? Centara is a plan that's bigger in the Tidewater area, but it is available in Richmond, and it has some great benefits. The network isn't big, but if your network is within it, a lot of people liked it because the benefits were big. However, it is ending at the end of this year for people that are on it that are not on Medicaid. So the people that are on Centara have no choice but to find a new insurance company because their plan is ending. So for my clients that I've come across that are in that position, because Centara had such huge benefits for them, like thousands of dollars worth of dental and so forth, which is exactly why it's ending, because it's just not like profitable to keep. I tell them, use up that stuff before December 31st. Don't wait till December to do your dentist. If you have that much amount, or if you have those kind of benefits, use it before December 31st. And if you're gonna use something before December 31st, that means you need to start making the appointment from now. Because just because December 31st comes around the corner, an appointment now can take, some time to even get, and then the initial appointment might not be the date that they're doing the procedure. They might be just doing a consultation, and then, you know what I mean? So you want to give yourself wiggle room for that kind of timing to utilize the benefits of the plan year that you're in. Any other questions? Sure. So right now we're in AEP, that's annual election period, and that's from today, October 15th, to December 7th. And then open enrollment period, which is OEP, is from January 1st to March 31st. And these are annual, so these happen every year. So this AEP is to start into effect for January of next year, and then the OEP, from the date that you sign it, it will begin the month afterwards. So if you sign up in January, your plan will start in February. If you sign up in February, your plan will start in March. Mm. You can change your plan as many times as you'd like. One-time change, and it has to be to a plan similar to the plan you're on. So if you're on Medicare Advantage, you need to get on another Medicare Advantage. If you're on a prescription drug plan, you need to get on another prescription drug plan. That's how that works. That's a good question. Any other? Yes. Mm. It depends on the facility that you go to. Some facilities do everything in-house. Some facilities outsource everything. So, of course, you just showing up just trying to get your stuff done, so you don't know if they're in-housing or outsourcing, but you'll know when those bills come. So, like, take, for instance, if somebody is at Centerwell can in-house pharmacy coverage, they can in-house a couple of things, and then That's why some people love Bon Secours, because Bon Secours has a lot of different types of facility within their facility. They've got the x-ray stuff within them. They've got the lab, you know what I mean? Whereas some facilities are medical offices that have to send out to do everything. So even if you feel like you're getting it there, they are sending out your work to different places and billing different places to get the work in that facility. You know what I mean? Right. Right, yeah. Yeah, and then the systems don't speak to each other like that. Right, right. So it would be like the difference between, I guess, it would be the difference between, I'll think of a good analogy, but right now it's not coming to the top of, but going to a facility where you get everything done within that facility and it's already embedded in that facility is similar to going to Walmart and buying Walmart branded items. It's going to be cheaper. It's going to be more like within the umbrella of that space versus going to Walmart and there's a Coca-Cola stand inside there and you're getting their Coca-Cola. You know what I'm saying? It's cheaper for the company when they can in-house, and it makes it cheaper and easier for you. So that's how that happens. Yes. Uh-huh. Mm-hmm. You mean different medical facilities? Yeah. No. Bon Secours is Bon Secours is Bon Secours. I believe Bon Secours bought those saints, so those are under the Bon. But VCU is its own medical entity. The VCU. I'm sorry. Chippenham, yeah, Chippenham is separate from Bon Secours as well. Is it? Say that again. She said Chippenham is HCA. I I think they have an affiliation. An affiliation is different from being like owned by the facility. So an affiliation could be a partnership that two different entities came up with to say, listen, if you have this many people and you need this here, we got you. And if we have, right, that's an affiliation. But I did check, and yes, you're right. It's HCA is the system that Chippenham is under. Yes. Right. Right. Yeah. Yeah. Yeah, definitely. VCU is that's its own entity as well. Yes. Oh, the MCV is, yeah, sorry. MCV and VCU are the same. Chippenham is its own thing under HCA. Bon Secours is its own thing under Bon Secure. And VCU is definitely VCU. Yeah. Mm-hmm. Mm-hmm. You can still what? Oh, yes. Yes. Uh-huh. Uh-huh. Mm-hmm. Which way are you finding that happening to you? Through letters, through calls? Centerwell is owned by Humana. You, yeah. So it's in Humana's interest to ask you to go to Centerwell. Um, and Centerwell operates, this is super behind the scenes, but I'll educate you on it. CenterWell operates in different ways. CenterWell can be, you see those CenterWell doctor's offices, and then there's CenterWell, the pharmacy, the mail order pharmacy. So even though those are the same name, they operate in two different spaces because somebody can have Anthem Blue Cross Blue Shield and go to a CenterWell, uh, you know, primary care physician. Somebody can have United and go to a CenterWell primary care physician. Whereas in terms of the CenterWell pharmacy mail order, you have to have Humana and be getting mail order in order to get the CenterWell mail order. You understand what I'm saying? Well, this piggybacks into what he mentioned, which is why is it that I'm doing one thing and I'm getting information in the other? And because you have Humana and you've been getting mail order through CenterWell, now CenterWell has your information and say, hey, you know, you go to CenterWell for your pharmacy, you can come here to also get your primary care physician. It's up for you, it's up to you, as my father likes to say, to put your stick in the ground and say, this is what I'm comfortable with. I'm not interested in that. Right, right. Mm-hmm. Right. Mm-hmm. Mm. Mm-hmm. Mm. Mm-hmm. Gen Cares, and I think there's Oak Street Health. Those are all primary care providers that are, um, they work with Medicare. They're supposed to, like, you know, do certain metrics for people. You go to the doctor that you've been going to that's working for you. The only time I suggest a Gen Care or an Oak Street Health or a CenterWell to somebody is simply if they are a person that's just lollygagging around and don't have nobody to go to. You know what I'm saying? But somebody that is actually with a provider that's been working with them and helping them keep their health metrics in order, that's where you want to stay. Hmm. Any other questions? Yes. No, Gen Care is what I just mentioned. It's a primary care provider group. So they only do primary care physician. I think they might have one or two specialists in there, but they only work with Medicare beneficiaries. And all of them work with the same insurance companies. And that's why I'm letting you know that just on a back end, like, all these insurance companies work together. So you really just have to pick which one is operating in the best benefit for you. But they you know, they might differentiate and maybe like the type of the way they operate in terms of um, if you get your cards in time and if you know what I mean, like certain things like that. But they all work together. Yeah, because they're all being paid by the same entity, which is the Center for Medicare and Medicaid, which is a federal system. So basically, they've privatized Medicare so that the federal government does not have to deal with everybody just with the original Medicare card and have to deal with all the claims and all of the, so they privatize they pay insurance companies to be the ones to distribute the benefits to you all. So that's how that works. Yes. A center well. You you can't see other primary care physicians, but you should be able to see your other specialists because they have limited specialists within those. So that's why when you're joining those kind of organizations, it's for someone that just needs to get a regular PCP, basic stuff. And also, sometimes it's for a client who getting picked up to go to the doctor is very important to them because they do that. And while some of the insurance companies are shaving the transportation benefit, it might not seem like a lot to somebody here who's driving and going about their business to get stuff. But for somebody that has, I had a client today that told me because their Humana transportation dropped that they're going to have to take the bus. I just looked at him because he could barely walk to where I was at. So I'm trying to figure out how he's going to walk to a bus stop and get on a bus and all of that stuff. Yeah. GRTC will pick up anybody in Richmond? And you had a documented ailment. So then we have to get him a documented ailment. Mm-hmm. Yeah, okay. Mm-hmm. Mm. Nice. Mm-hmm. 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 Mm. That's good to know. Yeah, I was about to say you have to call for an appointment. How long in advance do you have to call? Mm-hmm. Mm. Mm-hmm. Mm. I don't know. No, it's not. I don't think so. Uh-huh. Is Greater Richmond, yeah. It depend, and it also it depends on. I think with GRTC, I think it depends on the differences between where you're getting picked up because I think you have to be a resident of Richmond. Yes, but I think they will drop you outside of Richmond, but I don't think you can be living outside of. Mm-hmm. Mm-hmm. And I can't either. I don't want to act like I have a lot of benefits on GRTC. Mm-hmm. Mm-hmm. Any other questions? This has been really a lot of great questions. Any other questions? Well, again, you've got Regina right here. If you have any desire to take a look at your benefits, see what's on the market for 2026, or just be able to compare what you have to what's going on in 2026, I really appreciate you all coming and taking the time to be here, and I hope this has been somewhat informative to you and that you've been able to pick up a little bit more than you came in here with. I'm really grateful to you all, and I hope you all have a successful year and that you stay safe. And I thank you for your time. Yes.
Let's give her a hand. too. Make sure you apply for the B, or either talk to people that you know that are not here. They apply for that B if it's time for them to apply. Because, see, I applied for it. Even though I'm on the original Medicare, I applied for it. Then I said, shoot, I'm not going, nothing go wrong. I'm going to get off of it. So I got off of it. A month later, I had thyroid cancer. Mm-hmm. B, part B. And I had thyroid cancer, and then after they did the surgery, and every 7.5 hour surgery, I was billed $3,000 because I didn't have the B. I hurried up and got back on the B, but I was penalized for 6 months. I didn't have any insurance. So you would, and see, it's people out there that don't know, and that's what upsets me so bad, and why I got in Medicare. I mean, got to be a Medicare agent, because there's too many seniors out there that don't know. And another thing, you got to always remember the 3 Ps every year. That's about your provider, your prescription, and your personal changes. So don't ever say that, oh, I'm going to stay with Humana or Aetna, and you don't know what's going on because you haven't looked at the changes in your book, because most people don't read. They just get the book and put it down. Well, it's too much, but still it's showing you what you will need in the future, because just like I gave you my example, and that $3,000 hurt and stuff. So always apply every year and get with your cousins or whoever that's sitting there. Another example, one lady, I helped elderly people. She needed a roof, and I, called Project Homes and got her roof, and her flooring was gone, and ceiling fell down, and she's 92 years old and just had her legs amputated. And so I stuck with her for 7 months. So now the tin roof is gone and all that. But one day I was talking to her. I said, let me see your cards. She took her cards out, her medical cards, and she had Medicaid and didn't know it. And she was putting out all that money, 92 years old, putting out all that money. So most seniors don't know what they have. You got to work with them. I get real teary-eyed about that, and that's why I said when I was in church Saturday, children, you got to look out for your mom and dad, because, hey, they won't be here all the time, and who's going to take care of you? So just remember those things and check your insurance, and just make sure the people that you know also to check theirs. Question?
I have a question about this card.
Yes.
If you were requesting a call, will Assure show up on the
That is us, the insurer.
Will that show up on the
That's
card?
a company.
Oh,
That's
no, not on your insurance.
insurance, no.
You talking about your insurance? No, I'm saying if you call them, right?
Mm-hmm.
Oh, no, 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 no. If you call them, what I did was identify as a true caller, right?
Yes. Mm-hmm.
It'll be a
I
true
will be
caller.
calling you. Right.
And we'll show up Assure.
Right.
They will not
That's
call back Assure.
no.
It'll be called.
That's just giving me permission to call you.
Okay, so what will I see on my caller ID so I know it's true caller?
My telephone number.
Okay.
That's on the card. It's on the other side.
Oh, okay. Thank you.
Mm-hmm. I gotta give it to you.
Okay, Medicare Advantage plan, the one we have all the coverage, that doesn't have Part B on it?
You're supposed to apply for Part B. You get Part A free. Because, see, from working.
Right. But Part B doesn't come automatically, you have to apply.
Yeah, you have to apply for it.
So then you should get in touch with your place and find out if you have Part B.
Right.
Because it doesn't show on your card.
No, it shows once you apply for it, but it's not going to show automatically. You don't automatically get Part B, just Part A.
Okay, but does Part B cost anymore?
Oh, yes, it costs. You can pay for it yourself, or it comes out your Social Security.
Oh, so I got all my insurance plan if we have Part B.
Right. If it's not on that card, they used to send you, when you get Part B, you'll get another card with A and B on it. And it's a red, white, and blue card.
I don't have a question, I got a comment.
Okay.
In the accident you had with him, the personal interaction you had with him, all of us are conscious.
Mm-hmm.
Some people need that assistance to get exam. And that's why I appreciate you for coming, I appreciate you for coming.
Say it louder so they can hear it.
I said, I appreciate you you from coming and you for coming. That personal interaction you gave me just now, that's what we all need because a lot of us here hear what you're saying, but I get that Medicare book. It's not that easy to go through that book. So you need that personal interaction, that's why she's here today. So if you contact her, then she'll get back with you.
Any more questions? You had a human. If you need a book, just call. We'll send it to you. Okay. Okay. Any more questions? Is your over here? One o'clock. Okay. Yes. Any more? Yeah, I'll call most of you tomorrow. Either put a time down when I can reach you. Because we don't just call you and say your name like the telemarketers do. You need a call?
And if you are, if you're somebody that does, you're being inundated with, what's the word I'm looking for?
Here you go.
Junk calls, then I would suggest you to have a conversation with her and call her first so that you can save her phone number. That's how yeah, so that you can save it. Yeah. Right, right. Yeah, I know it's really mail and calls.
Okay, come on, ask your questions now. Whatever you can think of, ask them now. That's right. I still want your questions so everybody else can hear it. Okay. No, the questions would be for the people that are here. Well, see that? See? 804-393-1743. Okay, he got a call, but I took it back. Y'all funny. Y'all funny. You can take my picture. Come on. Oh. Take Nadine too. She come home. Who needed another call? Okay. Okay.
Okay,
All
thank
righty.
you.
So that's the last question. Going, gone, because I want to close with prayer. Okay, bow your heads. Thank you, Lord, for having this awesome, awesome educational event. I want to thank all of you that came, and when you leave, I want you to get to your destination safely and without any problems, and just thank God for just being out there and getting home. So thank you, everybody, for attending, and I appreciate you.